Hey everyone, and welcome back to the OET Bank podcast. We're here to help international doctors and healthcare professionals build their careers abroad. Today, we're tackling something that comes up again and again for IMGs moving to the UK, the job titles in the NHS. They sound kind of familiar, but when you dig into what they actually mean, the details can be surprisingly different.
Yeah, totally. And if you don't know the structure, you can easily misjudge where you fit, or even apply for something that isn't what you expected. Once you get what these roles involve day to day, you can map out your career path a whole lot better.
Alright, let's start at the beginning. What's the deal with being a junior doctor? Because that phrase shows up everywhere.
Right. So, junior doctor isn't actually an official job title. It's more of a blanket term for anyone below consultant level. Inside that group, you've got foundation years, core training, and specialty training.
Okay, so FY1 and FY2 are foundation doctors, right?
Exactly. FY1 is your very first year out of medical school. You rotate through different departments, say general medicine, general surgery, maybe psychiatry or emergency medicine. You're shadowing seniors, writing notes, doing the basics. FY2 is a step up. You're still rotating, but you take on more responsibility.
So it's kind of like internship or residency in other countries.
Yeah, exactly. Imagine residency in the US, but with shorter placements across more specialties. Instead of locking into one track right away, you get this broad exposure.
That sounds intense, lots of moving around. Do IMGs struggle with that?
Sometimes, yes. The constant rotation means you're always the new person, which can be exhausting. But the upside is you get a really wide perspective before committing to a specialty.
And then core training CT1 and CT2?
Right. Core training is usually 2 years, and you might rotate through 4 different medical or surgical specialties. For example, one rotation in cardiology, another in gastroenterology, then maybe ICU and geriatrics. By the end, you've got a clearer sense of what you want to focus on.
And then ST1 and ST2, specialty training?
Yes, that's the early stage of focusing in. You're choosing your field like radiology, pediatrics, surgery. The daily work is more responsibility, leading ward rounds, managing patient lists, handling night shifts, writing discharge summaries.
And what about SHO? I keep seeing that term.
Yeah, SHO stands for Senior House Officer. It's an old term, but it still pops up in job ads. Usually it describes C-tone half or stone half doctors. So if you're an IMG, don't be thrown off if you see SHO. It's just another way of saying early stage trainee.
Alright, so once you're done with those early years, what happens when you hit ST3 and above?
That's when you enter advanced specialty training. People call this middle grade. You're still technically a junior doctor, but at this stage you've chosen your field and you're digging deep.
So what's different about daily life at that point?
A lot more responsibility. You might be leading ward rounds, supervising FY1S and FY2S, or being the go-to person on call for your department. You're expected to make decisions and manage cases with less hand-holding.
That sounds like a huge step up.
It is. For example, in surgery, you might actually be performing operations under consultant supervision. In internal medicine, you're managing complex cases on your own overnight. The training can last years, sometimes ST3 through ST8, depending on your specialty.
So for IMGs, this is where you really start carving out your niche, right?
Exactly. If you're aiming to build a UK career, this is the stage where your specialty choice really defines your future.
Okay. Now what about specialty doctor? That one always confuses people.
Yeah, because it's not part of the training ladder. A specialty doctor has at least 4 years of postgraduate training, 2 of them in their chosen field. It's more of a service role. You're not climbing the training ranks, but you are an experienced clinician.
So why would someone choose that instead of staying on the training track?
For UK doctors, it often comes down to lifestyle. Specialty doctors usually have more predictable schedules, fewer on-calls, and more stability. For IMGs, it's a really common entry point. It gives you NHS experience, decent pay, and the chance to prepare for Royal College exams while still working.
So it's like a balance, less pressure than training, but still a respected role.
Exactly.
And then there's specialist doctor. That sounds almost the same.
Yeah, and that's where people really get tripped up. Specialist doctor is a new role introduced in 2021. It's for senior doctors with significant experience and specialty qualifications.
So what do they actually do?
They do advanced clinical work, supervise juniors, make key decisions, basically a lot of the same responsibilities as consultants. The difference is, they don't need to be on the specialist register.
So for IMGs, that's a big deal.
Absolutely. It's attractive because you can step into a high-level role without having to jump through all the consultant hoops right away. For many IMGs, it's a realistic and rewarding career option.
Speaking of which, let's talk about consultants. They're the top, right?
Yeah, consultants are the peak of hospital-based medicine in the UK. To get there, you need a CCT, Certificate of Completion of Training. That usually takes about 10 years post-graduation. Consultants lead teams, deliver expert care, oversee juniors, and often take on leadership responsibilities in the hospital.
And IMGs, can they just apply straight to be a consultant?
Not usually. Most IMGs enter as specialty or specialist doctors, then work toward CESR, which is the Certificate of Eligibility for Specialist Registration. That can eventually qualify you for a consultant post. Some IMGs do land locum consultant contracts, but permanent consultant positions straight away are rare.
So far, we've been talking about hospital-based careers. But what about outside GPs, locums, academics?
Great question. GPs are community-based. They're the first point of contact for patients, handling everything from diagnosing infections, managing diabetes, providing mental health support, vaccinations, prescribing meds, and making referrals to hospitals.
That sounds like a huge responsibility in itself.
It is. And it's a really central role in the NHS. Then you've got locum doctors, basically temporary staff. Think of it like being a substitute teacher. You step in when there's a gap, whether that's maternity leave, illness, or just staff shortages. Locums exist at every level FY1 up to consultant. The pay can be good, especially via agencies, but you don't always get stability.
And the academic track?
Yeah, academics focus on research and teaching. You'll see positions like academic clinical fellow, senior lecturer, professor. Some combine clinical work with research, others lean fully into academia. It's essential for pushing medicine forward.
So, after all that, what's your best advice for an IMG figuring out where to start in the NHS?
Honestly, start by being realistic about your entry point. London, for example, has a shortage of junior posts, so you may have to look outside the big cities. Think about your long-term goal, whether that's consultant, GP, or specialist doctor, and then plan your route backward from there.
So timing, flexibility, and strategy really matter.
Exactly. With the right planning, IMGs can absolutely thrive and even shape the future of the NHS. And hey, if you're also working on your English or preparing for OET, check out OET Bank. We've built resources to help international doctors and healthcare workers succeed abroad.